Blessed greetings, everyone, and welcome to the WSLM Radio Ministry podcast with Pastor Vince. It's Friday, October 31st, 2025. You know, I was looking at this report on mental health in America. It was done by an organization called Mental Health America, and the report is called The State of Mental Health in America 2025. Again, The State of Mental Health in America 2025. And you can find the complete 48-page report at mhanational.org. mhanational.org if you're interested. So I just skimmed through this 48-page report and I found some interesting information, some alarming information concerning mental health in America. And I will say this, that I'm almost 58 years old, and I'm so glad that mental illness is not stigmatized like it was when I was younger. I mean, I would say my generation, which is Generation X, my parents' generation, which would be the baby boomers, and then their parents' generation. It was stigmatized. Mental health illness was stigmatized. You were pretty much told to just get over it. You would brush things under the rug. You wouldn't really talk about it. You wouldn't express your feelings. You were raised to just get over it, not be able to express your feelings, and going to see a therapist, or back then, at least when I was coming up, people used the label shrink. Oh, go see a shrink or whatever. So the bottom line is that mental health illness wasn't as much in the forefront, or like I said, it did have that stigma to it compared to today. Today, we're promoting mental health more. Hey, it's okay to not be okay. You may have heard that before. But the bottom line is that though the stigma on mental health illness is not what it was generations ago or years ago, still, depending on the state that you live in, according to this report, you may not have access to mental health care as you would in other states. The information is different. The findings are different for adults, for youth. This report is just wonderful. So I just pulled some things out of this 48-page report that I just wanted to spend a few minutes and share with you. So some key findings. According to this report, key findings, it says New York, Hawaii, and New Jersey scored the best across 17 measures of prevalence of mental health illness and access to mental health care. So if you live in the states of New York, Hawaii, and New Jersey, just know that the prevalence of mental health illness and access to mental health care is better than other states. Now, if you live in Alabama, Arizona, and Nevada, they scored the worst, with higher prevalence of mental illness and lower access to mental health care. So, like I just said a moment ago, depending on what state you live in, access to mental health care may be better or may be worse. So, Alabama, Arizona, and Nevada scored the worst. Okay, and it says here, again, I'm reading from this report, this is the second year in a row that Nevada and Arizona were the two lowest ranking states. And I'm going to share more about the various states and where they rank in just a little while. It goes on to say that the prevalence of mental health concerns among adults in the U.S. has not changed significantly from 2021 to 2024. And here's some percentages. It says in 2024, 23.4% of adults in the U.S. experienced any mental illness, or they say AMI for any mental illness, in the past year, equivalent to over 60 million people. So again, this is in 2024. 23.4% of adults in the U.S. experienced any mental health illness or any mental illness in the past year, equivalent to over 60 million people. Here's another percentage. 17.7% of adults in the U.S. had a substance abuse or substance use disorder, SUD, substance use disorder in the past year, totaling over 40 million people. And here's another one. 5.5% of adults reported experiencing serious thoughts of suicide, totaling over 14 million people. Here's some data concerning youth. Mental health among youth in the U.S. improved significantly from 2023 to 2024. So the percentage of youth that's ages 12 to 17 who experienced a major depressive episode in the past year decreased from 18.10% in 2023 to 15.40% in 2024. Also, the percentage of youth ages 12 to 17 reporting serious thoughts of suicide in the past year decreased from 12.30% of youth in 2023 to 10.10% of youth in 2024. But still, young people are struggling in 2024. This is, again, talking about 2024. This report is the State of Mental Health in America 2025. Right now, I'm touching on some data, some findings regarding youth in 2024. It says 11.3% of youth, again, ages 12 to 17 in the U.S., experienced a major depressive episode with severe impairment in the past year, meaning it severely impacted their functioning at work, school, or home. That's a total of 2.8 million youth whose depression significantly impaired their functioning. Nearly 3 million youth, again, ages 12 to 17, reported frequent thoughts of suicide. Now, let's talk about access to mental health care. I've already said that depending on what state you live in, access to mental health care may be better or it may be worse. So let's look at some percentages from 2022 and 2023. Access to mental health care remains out of reach for millions of people in the U.S. who need it. Again, we're talking about 2022 and 2023. 77.09% of adults, of all adults, with a substance use disorder did not receive treatment. Again, we're talking about 2022 and 23. 77.09% of all adults with a substance use disorder did not receive treatment. Wow. 9.2% of adults with any mental illness were uninsured, totaling over 5 million people. That's something I've learned about the mental health care system is that, many people, they may have access to care or, there may be enough facilities or professionals in their state or in their community, whatever, but because of insurance issues, they cannot get access to the care that they need. So I know insurance, even when it concerns physical health. Okay, so I say physical health, mental health. I have worked in the healthcare industry now over 40 years concerning, if you want to say, physical health issues. And I know, and I'm sure you know as well, how critical insurance or lack of insurance is concerning access to healthcare concerning physical health conditions. But again, right now we're talking about mental health conditions. 9.2% of adults with any mental illness were uninsured, totaling over 5 million people. There are many people who cannot, get therapy get the therapy that they need because they are uninsured, or maybe that facility does not even accept insurance. So these people have no other option but to pay out of pocket, and they can't afford to pay out of pocket. So insurance, we know, when it comes to healthcare, is very, very important. 28.6% of adolescents ages 12 to 17 did not have a preventive health visit in the past year. That totaled over 7 million young people in the U.S. It goes on to say that 1 in 4, or 25% of adults with AMI or any mental illness reported an unmet need for mental health treatment in the past year. So it concludes by saying in the U.S. there were 320 individuals for every one mental health provider in 2024. I'll say that again. In the U.S., there were 320 individuals for every one mental health provider in 2024. All right, I want to conclude by saying or sharing these findings with you, state findings. I said a little while ago that I wanted to go over the state findings and share with you the rankings of the various states. So I'm reading directly from this report from the State of Mental Health in America, put out by Mental Health America. Again, you can find it at mhanational.org. The State of Mental Health in America 2025. It says an overall ranking of 1 to 13 indicates lower prevalence of mental illness and higher rates of access to care. So again, if this state is ranked from 1 to 13, it indicates lower prevalence of mental illness and higher rates of access to care. Now, an overall ranking of 39 to 51 indicates higher prevalence of mental illness and lower access to care. So there are states where there's a lower prevalence of mental illness but higher rates of access. Then there are others where there's a higher prevalence of mental illness but lower rates of access to care. So let's just go over some of these states. As a matter of fact, I'm not going to go from 1 to 51. I'm at least going to share every state from 1 to 13. These are the states that have a lower prevalence of mental illness and higher rates of access to care. So if you live in one of these states, if you live in one of these 13 states, you have a higher rate of access to care. Starting at number 1 and going down to number 13. Starting at number 1, New York. Number 2, Hawaii. 3, New Jersey. 4, Vermont. 5, Iowa. 6, Massachusetts. 7, Pennsylvania. 8, Maine. 9, Connecticut, my home state, though I now live in North Carolina. 10, Illinois. 11, Washington, D.C. 12, Ohio. 13, Michigan. 14, Indiana. Okay, I went a little too far. Okay. Anyway, so I just gave you 1 to 14, but 1 through 13 are those states. Again, 1 through 13 would be New York, Hawaii, New Jersey, Vermont, Iowa, Massachusetts, Pennsylvania, Maine, Connecticut, Illinois, D.C., Ohio, and Michigan. And I'll just give you just a few states. I won't go through every state from 39 to 51. Okay, let me look this over again. Okay, 1 through 13, and then 39 to 51. Okay, so 39 to 51 would include like South Carolina, Oregon, Tennessee, Wyoming, Alabama, Arizona, and Nevada. I told you earlier that those were the worst states. You know, they were at the bottom of the ranking scale. So anyway, that's just some information I wanted to share with you. Didn't want to bore you with a whole lot of numbers in this episode, but I wanted to share it with you, just give you an overall picture of the state of mental health in America, according to this report put out by Mental Health America. Again, as I said at the top of the episode, I'm so glad that mental health or access to mental health is more prevalent than it was years ago, though many states are suffering in terms of access to mental health care. We know having insurance, as I've already stated, not having insurance is very critical. But the bottom line is we don't have the stigma attached to mental illness as we did years ago. And I'm so glad for that. So I hope this information sheds some light for you on the state of mental health, at least in America, and what we need to do as a society to support those who are suffering mental health illnesses, support them through education, therapy, we ourselves getting educated on mental health care. I shared in a previous episode how how the church can be more involved in mental health care. It doesn't have, you don't have to be a licensed professional to care for someone who may have a mental illness, things of that nature. We all need to get more involved when it comes to mental health care. Just like, well, as I said, I've spent over 40 years in the healthcare industry. I worked as an EMT, paramedic, and other direct patient care roles. And I know even today in 2025, you do not have to be a medical doctor in order to provide first aid to someone. You don't need to be a medical doctor or a registered nurse to know how to do CPR and things of that nature. So even in mental health care, you don't have to, you don't have to have a doctorate degree. You don't have to be a licensed therapist to care for someone. Sure, you are limited as far as what you can do, but the bottom line is you do not have to be a licensed professional to be able to care for someone who may be going through a mental health crisis. You could be the start of providing care for that person, and if need be, you can refer them to someone who has more training and so forth and so on. Okay, so let's all get more involved in supporting those with a mental health illness. All right, I hope this blessed you. I hope this helped you in some type of way, and I will continue from time to time to share such information as I come across it. One last time, in case you missed it earlier or whatever, it's called The State of Mental Health in America 2025. This is the name of the report. It's put out by Mental Health America. You can find them online at mhanational.org. All right? Be blessed. Have a great weekend ahead, and we'll talk again real soon.